Thank you, Bill. I am president of Iowa Farmers Union, which is part of National Farmers Union, and we have 250,000 members nationwide. And we're very concerned about healthcare in rural America, not only for family farmers, but for rural people, small town residents, and like-minded folks. The healthcare system, especially in rural, is, I guess you could say, way beyond a mess. It's a disaster. System's broken, and I'll give a couple of examples why. I make it very clear the system's broken, not the nurses or the doctors or caretakers or whatever, but we out here have basically two choices when you're self-employed or have a small business. No insurance or high-cost individual private market insurance. And right now I'm sitting with right at $1,000 a month between the wife and I for insurance. We went without health insurance at various times in our farming years because of you're farming. You don't know from one year to the next what kind of money you're going to have, and you need to prioritize money. And the number one priority is being able to farm the next year, and everything else comes after that. So over the years we went without insurance. As we've got older, we've realized that we need insurance, and in going in and out of the insurance, I have basically got to the point now with some health issues that I'm not acceptable to any private insurance. I've had to go to HIP Iowa Insurance, which beginning of year, my premium per month at $1,000 deductible, I think, is approximately $517 a month. My wife has remained in the private market insurance, and she's got some health issues, but her costs went up 42% from last year. Hers is approaching $450 a month. So you can see the high cost and the money you need just to provide some kind of catastrophic cover, and that's all this insurance is. You know, as it goes up, you raise the deductibles, and pretty soon you wonder why the hell you have it. But it's for catastrophic events. And so when you have high copay and high deductibles, you wonder, you don't utilize it in the sense of preventative health care like you should. You don't go to the doctor. Wife's had a bad ankle for years. We never have had it looked at because you got to cough up the $2,500 or whatever deductible you have. So I think you understand the point there. And it reflects on the national figure that no wonder we only have 4% of the money in this country and on the health care that is spent on preventative care and preventative issues. And so that's kind of where we're at with healthcare, and I know thousands of rural people and family farmers who face the same thing. And yes, I have medical debt. Don't know how the heck I'm going to pay for it, but this is going on out here, and this is unacceptable in a country that is the wealthiest country in the world. And we as a community need to address these issues. Thank you.
Thank you, Chris. That's really moving when somebody is willing to share their own story as well as advocate for the other farmers that he represents across the state of Iowa. Iowa for Healthcare, we are urging folks to please, this is our call to action. When you see a presidential candidate, or if you can reach out to one, ask them how their plan makes quality, affordable healthcare for all a reality. And go to caucus for whichever candidate that you feel has the best healthcare plan. Thank you all very much for coming today. We appreciate both of you, especially coming out in this ice storm weather that we had last night. And that wraps it up. And if you have any further questions, we're open to questioning too. Thanks so much.